Welcome back to Getting to the Root of It, a video series brought to you by Mental Dental and Colgate, where we talk with professionals in the dental field to provide background on the different career options available for dental students after graduation. Today, I'm happy to be joined by a really great friend of mine, and this is Dr. Feifei Huang, who received her BA degree in psychology and global health from Northwestern University and then earned a Doctor of Dental Surgery degree at the University of North Carolina. She continued her education at the Einstein Medical Center in Philadelphia, completing a general practice residency where she gained extensive experience in trauma and surgery. Working as a general dentist, Dr. Huang discovered her true passion for endodontics and returned to UNC, where she received her Master of Science and certificate in endodontics. While at UNC, Dr. Huang received numerous accolades, including the American Association of Endodontics Achievement Award, plus the American Dental Education Association's Fellowship. During residency, Dr. Huang completed master's level research about artificial intelligence in dental radiography and presented her research at national meetings. Dr. Huang is a board-eligible endodontist and an active member of the American Association of Endodontics. Feifei, it's great to see you again, and thanks for joining us today.
It's so nice to see you again. It's been a few months.
It has been. How have you been?
I've been great. I'm working in Pennsylvania. I live in Jersey. I love being an endodontist. It's been wonderful.
Awesome. Well, let's talk about that a little bit. Endodontics. So, what brought you to that specialty? Was there a defining moment for you? How did you get to where you are today?
Yeah, that's a really good question. For those of you who don't know what endodontics is, it's the part of dentistry in which we do root canals and root canal related procedures. And so I've always really enjoyed working with my hands and doing puzzles. And what endo is actually a really cool puzzle. I mean, every tooth is very different. It has very different anatomy. And I'm always trying to get to the apex. So I'm the type of person who really likes using different techniques to perfect my craft. And I think that's why endo really fits me as a person. Also, when I was in endo lab, I just really enjoyed doing root canals and I felt really at peace with the procedure, which is not how I felt when I was doing other parts of dentistry. So I kind of always just knew.
Mm-hmm. Yeah, that's awesome. We were talking before this about our mutual love for escape rooms and puzzles and things like that. So I can definitely relate to that aspect. Could you describe a little bit like your day-to-day routine as an endodontist and what that looks like?
Yeah, so a little background, I work in a group practice. So there's 5 doctors and 3 offices. So I wake up every day and depending on the day, I drive to a different office to work and they're varying distances from my home, about 45 minutes to an hour. I usually start my drive because it's pretty long with a really good podcast. And recently I've been listening to a lot of White Coat Investor,
Mm,
which I highly recommend. When I get to work, I check my schedule and I normally see about 6 to 7 patients a day, which is pretty standard for an endodontist. Each appointment ranges between an hour to an hour and a half, and I do consults in between. Um, Recently, a really big part of my day has been reading and interpreting CBCTs, which are 3D scans and very important in endo treatment. And that helps with diagnosis, treatment planning, and treatment complications. And at the end of every day, I spend about 30 minutes to an hour writing my notes and calling dentists to talk about treatment plans and important cases. And one thing I think most people don't realize about endo is that we are normally on call. So because I have 5 doctors at my practice, I take call every 5 weeks and I answer all patient emergencies after hours and on weekends.
awesome. So, as far as like how it's been as an endodontist, do you have particular likes or dislikes or specific challenges that you faced?
Yeah, so the thing I really love about endo is that I can give every patient the individual attention they need. When I only see 6 to 7 patients a day, I can focus on diagnosis, treatment, planning, and making sure that every procedure is perfect, which is my personality. Something that I don't always enjoy as an endodontist is that what we forget is, as an endodontist, most of the patients that we see are in pain. So when patients are in pain, they're not exactly their best selves. And so I spend a lot of my time managing anxious and upset patients, and it's a part of my job on a daily basis. So you have to be kind of good at navigating that.
Mm.
And some challenges I've had is mostly communication and treatment planning. Every day I try my best to talk to general dentists about cases, give them updates about their patients, and make sure that we're aligned to the same treatment plan. And that's been challenging because every dentist likes to communicate in a different way. So whether it's text or phone call or message or calling through the front desk, that's been something that I've been navigating at this new practice.
Hmm. Yeah, that's a really good point. I feel like that's true for a lot of specialists in the dental
Mhm.
field, as well as dentists, because that's not something we necessarily get practice with in school or residency, is communicating with others. We're really responsible for the treatment that we're doing at that school on that patient, and that's mostly the end of it. There's some limited examples of communication, but I feel like you really get that differently when you're out in practice. And so navigating that is part of the learning process after school. It's a lifelong learning career, right? And that's definitely one of the things that you have to commit to learning and getting better at with time.
That is. And, working with people with different treatment philosophies is something that you learn to navigate over time too. A tooth that someone who practices for 20 years who thinks is restorable, someone who is fresh out from school may not think is restorable. And trying to finagle the differences and figuring out compromise is like something that we definitely have to deal with regularly.
Yeah, absolutely. So, how about any highlights of your career? Do you have any highlights that you'd like to share about being an endodontist so far in your practice?
Yeah, so I think, the best thing about endo, honestly, is finding a great job as an associate with really good bosses and partners who are 100% supportive of how you want to practice and let you practice by your own philosophy. I have a really wonderful low stress job, and I get to work with assistants who love to be there every single day. And I think that really makes a big difference in my everyday life. Other accomplishments that I feel like I've made besides finding a wonderful job is several experiences I've had where, I have worked at a hospital and I've been on call and dealt with dental trauma and maxillofacial trauma. And as a part of my residency program a few years ago, they allowed us to work in the prison system and deal with different populations of patients. And that's been really, really rewarding.
Oh, that's great. That's great. I remember you talking about that experience as being really impactful. So awesome.
Yeah.
Now, my last question would be anyone who's interested in pursuing endodontics out there, do you have any advice for that pre-dental student or dental student who might be considering this field? What should they do if they're interested in pursuing endodontics further?
So, depending on the type of program you want to join, there's very clinically based programs and there's also research based programs and programs that offer you masters. I would say the first thing is to try to do as much endodontics as possible in dental school or your residency program to make sure you absolutely enjoy the procedure. I know in a lot of dental schools, it's very difficult to get these cases, and it's very difficult to know if you like something after you've done it once or twice.
Mhm.
But try to be proactive, hang out with the endo residents, figure out how you can do as many cases as possible, and even consider doing an AEGD or GPR so that you have more experience in the procedure to make sure that you like it. The second thing about people who are interested in endo is that it's really important to network. It's a very small community. And so network with endodontists at your school, shadow endodontists in private practice. Every endodontist practices a little bit differently. So it's really good to see a range of how people do it and why they do it to see if it's a good fit for you. And lastly, for any specialty program, it's always kind of important to explore research opportunities to be a more competitive candidate.
Awesome. Well, that's really, really great advice. So thank you so much for sharing all of that. And it was great talking with you, Feifei. Thanks so much for
Aw.
doing this again.
Anytime.